Okay, so for this video, I would like to talk about two parasites that are evident in microbiology and how they are contracted, how they can be prevented, the symptoms of them, and then I'm going to show you about one thing that they have in common. They have a few more things in common that we're going to talk about too, but one thing I was really wanting to focus on. The first one I would like to talk about is toxoplasmosis. Toxoplasmosis is a parasitic disease that is caused by Toxoplasma gondii. This is a disease that's the leading cause of death and attributed to foodborne illnesses in the United States. Also, about 40 million people have this parasite and they have no idea that they have it. They are asymptomatic. They don't their immune system keeps it from manifesting itself, and so they have no idea that they have this parasite. The problem with this parasite and the people that it affects are infants born to mothers who have recently been infected. So people who were affected years or months prior to becoming pregnant normally do not have a problem with it, but once a woman becomes pregnant, and then if she is infected with this parasite, then it can cause some major problems for the fetus and for the infant, and it can also cause some mental problems for her as well, postpartum and things like that. Um, you can also be infected shortly when you become pregnant. If you're infected shortly before you could also pass it on to your child. And so they use tests to see when you were infected to make sure that your child will be okay. Another type of people who this parasite can affect the most are people who have a compromised immune system. So these are people who are already sick. They already have like chronic illnesses. They may have AIDS or immune deficiency disorders. Um, the One of the things that can also affect it is if you have toxoplasmosis and you're a very healthy individual, most of the time there's not really any treatment. And then later on, your immune system may become weakened and then it may activate itself. And so then you would be treated for it. So you can have it, and then your immune system can become weakened, and then it can you can start being symptomatic. How do you get toxoplasmosis? What are the signs of it? Toxoplasmosis is caused by eating undercooked meat, accidental ingestion by unclean hands. So one of the other things that it's caused by is cat feces. So if you often have pets and cats and do not clean up after them properly, um, or you're cleaning the litter box and you get some on your hands and you don't wash it all off and then you accidentally put them near your face. Um, this is a common reason of people getting toxoplasmosis. It can be transmitted from mother to child, and that is when the mom is infected during the pregnancy or very, very shortly before, and then passes it on to her child. And although this is very rare, you can pass it by receiving blood and organ transmission. This is very rare, like I said, but it's possible because people are asymptomatic, and so they could give blood, and then if they're not tested properly, if they don't go through the right screenings, they can pass it on to someone else because they're asymptomatic. Some of the signs for toxoplasmosis would be reduced vision, blurred vision. Most of the time it has lesions on the eyes, and it has flu-like symptoms for up to a month. So you can have flu-like symptoms up to a month and have toxoplasmosis. Some of the ways that we can treat and diagnose toxoplasmosis is the serologic testing. This is what I was talking about, the immunoglobulin M tests to see when you were infected with this parasite. This is what they use to test mothers to see when they were infected and in order to know if the child is at risk. It also measures the hemoglobin G. This is the test that shows you if you do have it. And the hemoglobin M is to show that when you contracted the parasite. You can also test it by cerebrospinal fluid or a biopsy material. You can also test it through that. Some treatment that they have for toxoplasmosis, most of the time people aren't treated for it. Most of the time it is that their immune system suppresses it and they just live with it. For pregnant women or for people who have weakened immune systems, they use the permethazine. The other type of parasite I kind of want to talk about is Campylobacteriosis, or the disease that it causes. Campylobacteriosis and toxoplasmosis have one thing in common, and it's cats. A lot of the time, cats are the carrier for these things. And they also have some similar aspects to it. They're both parasitic diseases, like I said. This is caused by different parasites called Campylobacterium. It also infects infants. This really affects people who have not as good immune system. So this is going to infect your infants. This is going to infect older people, and then your people with weakened immune systems. You can get it by eating undercooked poultry. Sometimes people will use a cutting board and not sanitize it properly after cutting up chicken, and this can be a reason that they contract it. Dog and cat feces is also how people can get this parasite. The dogs and the cats are carriers for it. Some signs of it are the bloody diarrhea, fever, and abdominal cramps. So how do we treat it and how do we diagnose it? So we diagnose it by laboratory tests. Basically, they're looking at stool. They can look at blood and the tissue sample, but most of the time they're just looking at the stool to diagnose it. Some of the treatment for it, like toxoplasmosis, most of the time their immune system will take care of it on its own or suppress it. So healthy people are not really treated for it, but people who have weakened immune systems or maybe at risk for a severe infection with this, it can get in the blood and cause a really bad problem for some people. But antibiotics can solve it for people who need it. Thank you for watching.